There's a world of social media or a part of social media that believes in general psychologists, the field of psychology is quote unquote not real. That it's all very suggestive. It's not actually helping people. What do you have to say to those individuals who believe that?
Well, I got to say that I have about 7,000 patients who would tell them they're wrong.
When I say hypnosis, most probably think of a magic show where people get invited on stage to get hypnotized and perform some ridiculous act. I'm not gonna lie, I too thought of hypnosis as more of a silly parlor trick rather than a proper psychological intervention. Well, that's about to change. Please welcome to the Checkup podcast, Dr. David Spiegel, world-renowned psychiatrist, Associate Chair of Psychiatry and Behavioral Sciences at Stanford University School of Medicine, and leading expert on hypnosis. Dr. Spiegel has spent decades studying the mind and exploring how hypnosis can help us overcome common medical problems like chronic pain, anxiety, and insomnia. He even claims he's seen it help patients quit smoking. Get ready to hear how you might be able to use hypnosis to address your problems using Dr. Spiegel's new app called Reverie. What's the official definition of hypnosis? Because I know you're part of the group that kind of formulated, right?
That's
the definition.
Me. That's right. It consists of three things: highly focused attention, or what we call absorption. Have you ever gotten so caught up in a good movie that you forget you're watching the movie and you enter the imagined world?
Is it like a flow state?
It's like a flow state in the sense that, Chick Sent Me High calls it an autotelic experience. You're just in it. You're not judging it. You're not evaluating it. You usually are enjoying it. It feels good just to be there.
Right.
So like when you get caught up in a movie, that absorption is inherently usually pleasurable. To do that, though, you have to dissociate. That's the second part. You put outside of conscious awareness things that would ordinarily be in consciousness. So right now, Mike, you're sitting in this chair. Hopefully you were not aware of your body sensations touching the chair. If you were, we could stop the interview right now. And so to concentrate that intently, you have to be able to put outside of awareness things that would ordinarily be in consciousness. That can be very useful for dealing with stress or pain, for example, that you can just dissociate, disconnect from it.
In a controlled manner.
In a controlled manner,
right.
Yes. Although sometimes it happens spontaneously, but
right.
What we do with hypnosis is show you how it happens and how to better control it. The third part of it is trying out being different, disconnecting from your usual way of being. So the thing that scares people the most about hypnosis is that they've seen one of these awful stage shows, where the football coach danced like a ballerina, made a fool of himself. Yeah. But I don't like that. But there's a message there, and that is you could try being different. And if you think about it, what we do in psychotherapy is help people figure out what it would be like to be a different kind of person. And in hypnosis, you can do that in a hurry. So it's what we call absorption, dissociation, and cognitive flexibility. It's a way of thinking differently. It's been called suggestibility. It isn't really that. It's an ability to disconnect from your usual ways of being and try being different.
What is the difference between a hypnosis session that would happen in an evidence-based setting like your office versus what happens on these stage shows when someone clucks like a chicken or whatnot?
Well, the phenomenon is similar. The uses to which it's put are different. So the phenomenon is this ability to concentrate intently, to suspend your usual means of evaluating yourself and others and try out being different and to dissociate. So it's really what you're using it for, not the phenomenon itself.
Okay. And are there uses of hypnosis that are unethical or problematic that can ever happen?
Well, look, we're all social creatures. We all are susceptible of social influence. We sometimes swallow things that aren't true, and God knows there have been enough recent very public examples of that. And so to the extent that we are willing to take in and act on other people's advice and suggestions, sure, you can get bad advice and suggestions with hypnosis as well. It is true that in hypnosis, you're more intensely focused. You may be less likely at the time to judge and evaluate. The old, it seemed like a good idea at the time kind of thing. But there's nothing inherently dangerous about the hypnotic state itself. In fact, it's better to know something about it, to know that you can engage in it to a certain level in that kind of intensely focused attention, to kind of protect yourself so that you know when you're likely to get caught up in something you'd rather not be caught up in.
Is there a range of this individual, like for me, I'm not very hypnotizable, but someone else may be. Is there a range that exists for that?
There absolutely is. Now, in the human life cycle, basically all 8-year-olds are in trances all the time. You call them in for dinner, they don't hear you. Work and play are all the same thing to a kid. But as we go through adolescence, we go through a period of valuing reason and evaluation more and just plain experience less. Mm-hmm. It's called formal operations by the psychologist Piaget. And by the time you're in your early 20s, you get set with a pretty fixed level of hypnotizability. So it's as stable as IQ from the 20s to the 60s. Mm-hmm. And so some people, about 20% of the population, are very hypnotizable. Their problem is staying out of hypnotic states, not getting into them. There's about 60% of us are somewhat hypnotizable. So you have an experience, you'll step back and think about it. We call them the diplomats. They negotiate their way in and out of it. Mm-hmm. And there's about 20%, we call the researchers, who just aren't hypnotizable at all in their adult life.
What can one do to become less hypnotizable?
Just stop listening to people.
Which is easier said than done these days, right?
Boy, you're not kidding. It's what I would say that the way to deal with the phenomenon is to just make yourself acquainted with it, mm-hmm. recognize it, and decide. I had a patient who said, I'm a disciple in search of a teacher. She mm-hmm. realized that she was always caught up in one kind of hypnotic influence or another. My late father, who also did hypnosis throughout his career, was a pioneer in the field, had a playwright who was a very successful playwright, but he found that people would come up to him on the street and just say, hey, I have this great charity, and you would and the next thing you know, he's writing a check, and his accountant said, you're doing pretty well, but you're not doing that well. And so we actually had him arrange a checking account where any check over $100 had to be countersigned by his accountant.
Wow, okay.
And so he would hand somebody the check and say, and I want to wish you a lot of luck.
It's like a level of hypnotic fraud detection.
Right, exactly.
What does it say about you if you're easily hypnotizable? Like, what risks do you face?
Well, I mean, there are advantages and risks. The advantages are you do get intensely absorbed in things. You tend to tune into other people very well. You see things from their point of view very easily. Those are all advantages. The risks are that you tend to be influenced, and sometimes you can be influenced by people who don't have your best interests at heart. Many humans are like that, but more hypnotizable humans are more likely to have that kind of vulnerability. Mm-hmm. So it's a good idea to try and keep that in mind and protect yourself if you find you're too easily influenced by other people.
How long into a conversation with an individual do you know that they're in one of these three categories?
2 or 3 seconds. No,
really?
No.
Okay.
Well, I get a hint, but we have a test on Reverie, actually, of hypnotizability. Mm-hmm. It takes about 5 to 6 minutes, and I know for sure how hypnotizable you are. Mm-hmm. And I get the feeling from the kinds of experiences people have. I had one guy who said, I got so caught up in movies, I just love doing it. So I'm thinking, yes, you're very hypnotizable. He said, so I decided to study filmmaking. And he said, I had to stop the course because it was ruining my experience of movies. Instead of just enjoying it, I'm thinking, well, why did they put the camera over here? And the lighting wasn't right. And so
I think that's a Dan situation.
Yeah.
Right? Our filmmaker problem, over right? Here, yeah.
So you can tell pretty quickly that there are people who just get deeply absorbed in things. And there is a correlation between natural absorption in everyday life and being highly hypnotizable. Whereas there are other people who are always critical and questioning and never swallow anything whole and don't believe anything they haven't read about a lot and things like that, who tend to be on the low side in hypnotizability.
Yeah. What's the biggest bit of misinformation surrounding hypnosis that you think permeates society?
The biggest is that you lose control, that somebody takes over your mind and makes you do whatever they want. Mm-hmm. And I made you into someone who would interview me on your podcast. Yeah. It's not like that. It's a state that you can use to help yourself concentrate more intently on what you want to concentrate on. And it's not it's the fear that you lose control. In fact, you gain control. And that's so this image of the Svengali and Trilby thing is just not what.
What
really
is that image?
That's the image of the story that the Phantom of the Opera, where this singer is taken over by this evil genius who controls her and makes her do everything she wants. It's really a way of enhancing your own understanding of your ability to control what you do, how you think, control pain, control anxiety, control habits. It's an opportunity to enhance your ability to use your brain to control your mind and your body.
Do you have to be willing 100% to be hypnotized, or is that something that can happen without your knowledge or consent?
Well, by and large, it's done with knowledge and consent. I'm sure there are circumstances where people who don't understand enough about their hypnotizability let themselves get into things, and after all, it seemed like a good idea at the time. So it's better to know more about it. You can better protect yourself. But it's something that you can protect yourself from. You can recognize the signs and say, no, I've been there before. I don't want to deal with this in this way.
What are those signs that people can look out for?
Just that I let myself get talked into something that I didn't really want. And there were 12 reasons why that I just sort of ignored about why I shouldn't have bought that property or done what that guy suggested or something else. So it's a way of learning about yourself and learning how gullible you are. And there are some people who will swallow things pretty easily and not judge them. There are other people who reject perfectly reasonable things because they're so critical and skeptical all the time that they don't engage.
Right. Like cynicism as opposed to skepticism.
Yes, that's exactly right.
So is being hypnotizable a form of gullibility or being gullible?
No, I'd say it's an openness to changing your point of view. And some hypnotizable people are gullible. But it's not, gullibility implies that, you just swallow it hook, line, and sinker, whether it's true, reasonable, plausible, or not. And most people who are hypnotizable can evaluate and judge what they're doing and make a decision whether to continue engaging or not. I would say what I try to teach people and what you can learn about on Reverie is the idea of recognizing the signs if you're getting sucked into something you'd rather not be. On the other hand, it's also a way of recognizing the ability you have to engage with novel treatments, to take and to evaluate it, and to help yourself by doing that.
The study of hypnosis sounds somewhat familiar in the study of psychology of influence. Is there a lot of overlap in these two fields? The reason I ask it is because my job as a social media influencer is to always be on alert at how marketers prey on insecurities of my patients, how they trick them into thinking that there are shortcuts for certain things, even the pharma industry through their advertisements. So I'm trying to do my best to become more in tune with the psychology of influence and even reading the book, Psychology of Influence. Does that go in line or overlap heavily with the study of hypnosis?
Well, I admire you're doing that. And given the ability you have to influence people, I really admire that you're taking that so seriously. I would sort of flip that question on its head, though, because one of the things that troubles me terribly is that the kinds of problems for which Big Pharma has used those sorts of media influences and has miserable advertisements every night on television is to use drugs for things that you can use your brain for instead. So last year, 88,000 Americans died of opioid overdoses last year. It's drugs for anxiety, drugs for insomnia are habit forming. And so they're getting people hooked. And people often ask me, well, if this hypnosis stuff is so great, why isn't everybody using it? And I say, well, I don't have a cadre of ex-cheerleaders going around to doctors' offices convincing them that hypnosis is the thing to help your patients with. It's drugs. And so I do worry about this kind of influence. I worry about social media and their capacity to make people worried about things they shouldn't be worried about. Or teenage girls, is one better looking than another, and what's that going to say for their next future? And so I think it's a problem that's, Jackie Gleason used to say it's bigger than both of us. It's a problem that doesn't just involve formal hypnosis. It involves all these things that influence people's attention and distract them from what really matters to them. So I would say hypnosis is, first of all, when you're using it for pain or anxiety or insomnia, the worst thing that happens is it doesn't work. It doesn't kill you. It doesn't give you serious side. There are no side effects to hypnosis. So it's relatively safe. And I think it's wise to learn something about yourself and your openness to being influenced by other people. And there are lots of ways that happens. Hypnosis is just one of them.
Why do you think in my med school curriculum, I think hypnosis was maybe covered in terms of quitting smoking? Mm-hmm. That's probably the only time it crossed my textbooks. Why is it not more well incorporated if it is so evidence-based?
I wish I knew. I've been struggling with that my whole career. It's the oldest Western conception of a psychotherapy. It's 250 years old. The first time a talking interaction between a doctor and a patient was thought to have therapeutic benefit. And yet it's still sort of the Rodney Dangerfield of treatments. Rodney, you remember him, he said they asked me to leave a bar so they could start happy hour. There is not the kind of money to be made in it that there is pharma. That's one thing for sure.
But like in that regard, CBT, there's not a lot of money to be made, we can say, and yet that's widely popular and taught in schools. So what is the divide there?
I don't fully understand it.
Any theories?
I think people are frightened of it. I think the football coach dancing like a ballerina, someone quacking like a duck, you can make fun of people. I think it's a little hard for people to understand. This 3-pound organ that sits on our shoulders connects to every part of the body. It controls every part of the body, but it doesn't come with a user's manual. And so there are things we can do with our brains that we may not be fully aware of. And sometimes that's scary. And you think, I just want to stay away from that. I don't know what it is. And so there are other kinds of psychotherapy. But all in all, psychotherapy doesn't get the same respect that psychopharmacology does. We tend to think that the only real treatments are incision, ingestion, or injection. That's the real stuff. And the other stuff, you're just talking to people. It doesn't mean that much. And that's not true. And I think hypnosis is sort of the limiting case of that. You go into an altered mental state, you can actually reduce the amount of pain medication you need. You can get through some kinds of surgical procedures better with hypnosis than you would with medication. People find that hard to believe and accept, but it happens to be true.
Yeah. I think in my many conversations with my patients and even podcast guests or my viewers at home, there's a belief on both sides where some people are very anti the incision medication route and prefer the quote unquote natural methods, which has its own quirks and weirdness because people think everything that's natural must be safe or healthy.
Right.
And then on the other hand, you have people like you said that are only about, give me the medicine. I don't want to do anything. There's no other way to fix this. Give me the surgery or give me the scan. And I'm like, well, the scan might not help, or the surgery might have longer recovery than you otherwise would with physical therapy. So I see it on both sides of the spectrum. Right. Where I see how in the medical curriculum of things, why maybe hypnosis isn't first line yet, because it may be at some point, is that I feel that there is A, the stigma that's associated with patients, and B, the idea when you give a medicine, you can study it on population basis, I feel like easier from an objective status, where you could see the dosage you need to give to get therapeutic value. You could see the dosage of the safety profile. You know that on average, if you give it this way, it's going to work. Is the training of hypnosis and the art or the science of hypnosis taught in the same way, where it's, if I teach it to you this way, you will get the same outcomes that I do?
Well, that exists. And it's been done, and I've done it. I mean, I thought when I started my career in psychiatry half a century ago that if I just, build it and they will come, do enough randomized clinical trials, do functional neuroimaging on what happens with hypnosis, we will publish enough that people will have to see it the same way they do the things you're describing very well. That hasn't happened. We've done it. So I'll tell you an example. We did a study with a colleague in Boston, Elvira Lang, published in The Lancet, randomized clinical trial, 241 subjects getting intraarterial cut downs to do chemoembolization in the liver and things like that. There were 3 conditions. They had standard care, which is push a button and get IV opioids. The second was that plus a friendly nurse to control for just kindly attention.
Sure.
And the third was teaching them self-hypnosis. By the end of 2 hours, the hypnosis group's pain levels were 1 out of 10. The nurse support was 3 out of 10. The standard care was 5 out of 10. And they were using twice the dose of opioids. They were pushing the button
It's like a
twice as
PCA
often.
pump.
PCA pump, right. And we looked at their anxiety. The anxiety in the hypnosis group was 0 at 2 hours. I thought they were dead or something. Nurse 3, the standard care 5. And the hypnosis procedures got done 17 minutes quicker than the other 2. And there were fewer complications, less autonomic instability, heart rate and blood pressure were better. So we published that in The Lancet. Now, if that were a drug that we did the study and had the same results, everybody'd be using the drug now during procedures like that. They're not. So I think there's just a tendency for people to not believe it even when it's done right.
What was the feedback or reception to the article being published?
There wasn't a huge reception. It was positive. There were no substantive criticisms of the study. Nobody said you can't do that. It isn't possible. It just kind of got ignored.
Yeah. So you're saying practitioner success rates don't vary from practitioner to practitioner?
They do, and I would say that the community. There's some excellent people, psychologists, physicians, dentists who use hypnosis, but there's a whole lot of variation in how they do it. There are at least 3 good professional societies: the Society for Clinical Experimental Hypnosis, American Society of Clinical Hypnosis, and the American Psychological Association has a hypnosis division. They teach courses, but there's a fair amount of variation in the way people approach it. And some of it is, a kind of hypnosis that I personally don't go for, that involves sort of just talk to the unconscious mind and the conscious gets in your way, which I don't agree with. So, there's variation in that. So some of it is us, and I think we make it difficult for people to get access because there just aren't that many of us. It's hard to get to a well-trained professional who uses hypnosis. And you're right, there is variability in how they practice, but there is in other parts of medicine too. It's not just hypnosis. So I think we could do a better job. And frankly, that's why, 3.5 years ago, with my colleague Ariel Poehler, who's a serial entrepreneur, we decided to start Reverie. I just thought, you know what? This isn't working. People don't have enough access to it. There's a lot of variability in how people use it. And we have a model that works. We have evidence that it works. We know what's happening in the brain when we're doing it with people. So let's make it available to as many people as want to use it. And so that's why I took the path I did with Reverie.
Right. For the study, we always see there's the study results and then there's like real world outcomes, right?
Right.
So the typical example I'll use on the channel is condom use in the study versus condom use in real life is lower success rate in terms of decrease likelihood of becoming pregnant. With a study like this, are the people that are having success with hypnosis, are those people who are part of the study that are interested in hypnosis versus if you put this into real world, you might not get the buy-in and maybe the lack of a better term, compliance with the general population?
Well, I'm sure there's some of that, but the people who went into that study in particular had enough interest in hypnosis to be willing to be a part of the trial, but they had to accept randomization into 3 arms, only one of which involved hypnosis. So 2 out of 3 didn't get the hypnosis. And that's true with any randomized clinical trial.
Right.
I think it has more to do with the structure of the intervention and less with, how much people want to use hypnosis. People want to get better. They want help. And in general, when you teach them how to do it, if it's got traction, if it can really help them, they'll do it.
Well, I wish that was the case. Yeah. I mean, from my primary care standpoint, how many times do I explain that, let's say, physical therapy or CBT, DBT, what have you, are avenues to get better, but patients might be reluctant to do that, may have financial barriers, time barriers, access barriers, where they don't end up going for the treatment, versus a pill has the simplicity of it. Cost not always the case, but it's more standardizable in their eyes in having success, so the compliance may be a little bit easier.
Well, I understand that, Mike, but at the same time, one reason we put Reverie out there is there's one big difference. Hypnosis is faster than drugs. So you will know within 10 minutes using Reverie whether it's going to help you or not. We ask people to rate their stress or their pain on a 1 to 10 scale at the beginning and at the end of the exercise. We find that 4 out of 5 people have a reduction in their stress level, an average of 1.5 points from beginning to end. So that's faster than a drug because you don't even have the drug from the pharmacy yet. So people can tell right away, and that's one reason I think it needs to be more utilized, just because you can try it. If it works, do it.
And what indications would someone try the app?
For stress management, anxiety, pain control, for sure, to stop smoking, to get to sleep, to get back to sleep. Very common problems. 25% of the U.S. population has an anxiety disorder. 40% have some kind of sleep problem, getting to sleep or staying asleep. So you can try it, and you'll know within 10 or 15 minutes whether it's helping you or not.
Right. Like frequently I'll give recommendations of bibliotherapy for my patients who are having mild depressive or mild generalized anxiety disorder symptoms. And I'll recommend a book by Dr. David Burns, Feeling Good or Now Feeling Great.
Right.
And, statistically, if their case is mild, they'll see the improvement. What is the situation if someone has moderate to severe anxiety? Would still using the app be beneficial, or is there now a risk of tapping into something that might yield worse outcomes?
Well, I don't think it would yield worse outcomes. It just might not help them that much. And there are just huge numbers of people with serious mental disorders who never get any help of any kind. And listening to you talk, I'm thinking, you'd be a good psychiatrist. You're thoughtful. You understand what the problems are. You know how to help people. And the majority of depression in the United States is treated by primary care docs, not by psychiatrists. So most people are not getting what some would say is the ideal treatment anyway. And what I think we ought to be doing is deploying techniques that have a decent chance of helping people. I mean, we've looked at tens of thousands of our users, and they report within 10 minutes feeling significant reduction in a moderate effect size reduction in their stress symptoms, for example, moderate reduction in their pain. 1 out of 4 people stop smoking using it. So that isn't everybody, but it's not a bad place to start.
What are the current guidelines in, let's say, in the APA, or I don't know what other organization puts out these guidelines, where hypnosis is first line treatment for a condition?
Well, both the American Psychiatric Association, I helped to write the guidelines on the use of hypnosis, and the American Psychological Association recommend that you get guidance in doing it from a licensed and trained professional mental health care physician, and that it's a safe and effective treatment. It is a recognized treatment by both major professional organizations.
Yeah, I find it so strange for me that, like, the resource Up to Date.
Oh yeah, I write for it. Yeah.
Yeah, so that's frequently a source that I use. Being a primary care doctor, I can see anything walk through the door at any moment.
And I have
to get well versed quick around the most up to date evidence.
Right.
So this is one way that I do that. And, hypnosis doesn't even cross the threshold for me when looking at generalized anxiety disorder or looking for insomnia. It's there as a potential means, I'm sure somewhere, but it's not first and forthright. And I'm still struggling as a young primary care doctor to figure out why that is.
I'm glad you mentioned that. I never look up hypnosis in Up to Date because I know I know about it.
You wrote
I'm going to look it up. I'm going to go home and look it up now. And I'll take it up with them. I think you're absolutely right.
Well, the reason I bring it up is, look, it's great that there's an option for an app for people to try at home, especially if it works quickly and it's simple and there's access to it. I think there's so much value to teaching providers.
You bet.
To make it more of a standardized approach, to make it more clear. I have read articles about issues with hypnosis surrounding like past life regression therapy and past life trauma therapy. And those are, things that are not evidence-based, where people are saying that you're feeling some sort of trauma from your past life. Let's get hypnosis to figure it out. Have you seen this sort of issue arise in the field?
Oh yeah, but only in one of my past lives. I know about that stuff. I have no patience with it at all. And, there are a lot of misguided thoughts about a lot of treatments of one kind or another. And that's, I think, not an ethical use of hypnosis. It can be very helpful in dealing with problems in this life, and including people who have suffered severe trauma of one kind or another. It can be I use it as an effective treatment, reliving episodes that happened earlier in people's lives, but I have enough trouble understanding what's going on in this life. I don't bother with previous ones.
That makes sense. What's your current stance on the idea of, in general, repressed memories?
Look, you know what? All memories are recovered memories. This idea that it can't possibly be true that you would repress a memory, especially of something traumatic, is just flat out wrong. And people who do research in memory point out that if things are trivial, you may just forget them because you never really encoded them very much. If they're extreme, they are accompanied by affective and somatic arousal that is very uncomfortable and painful. And one way people deal with it is dissociating from it, is putting it outside of conscious awareness so that it doesn't disrupt your everyday life. And so it is not at all implausible that people would not recall things that were horribly traumatic, or at least all aspects of things. It doesn't mean that everything you then remember is necessarily true. Hypnosis is not like going back to a video file and, reopening it and seeing it the way it was. But there is nothing implausible about people not all the time being able to remember traumatic events that are terribly disturbing to them. So it doesn't mean that if you recover a memory of childhood sexual abuse, for example, the memory is necessarily correct. Doesn't mean it's necessarily wrong. It means it's a memory. And if you want the truth about it, then you have to do what an investigator would do in dealing with a crime, get other evidence. What people report is one thing, but repressed memories can and do happen, and they can sometimes be recovered, and sometimes that's accurate.
How flawed is human memory?
I can't remember. It's sure. It's reconstructive. Memory is it's not just pulling up the file and playing it again. It's reconstructive, and
constructive, perhaps.
And it can be. You can embellish it in one way or another. But people have a lot of painful memories that are what really happened, and it hurts them because there are terrible things that have happened to people that they can recover memories of that can be accurate. So the standard of what you need to rely upon if you're doing psychotherapy for someone, for example, is different than if you're a police investigator trying to get evidence of a crime. It's a different level. But the idea that, memories that come up later are invariably contaminated is just as wrong as saying they're invariably true all the time.
Mm-hmm. How do you approach that with a patient who has a new traumatic memory come up? Because there's, an avenue where you can go full affirmation, you can go questioning, you can go full denial. What's like the optimal route here? Or is it just being open-minded?
It depends on what the purpose is. If the purpose is to help the person deal with the problem that they're having, then the standard is, I'm going to form an alliance with you, and the better you are at giving me a good feeling for what actually happened to you, the better I can be in helping you to deal with it. Mm-hmm. And so, it's a different thing if they're saying, well, my lawyer says I should bring up, a legal case against my ex-father or something like that. That's a different issue, and it's handled a different way. But in general, I'm trying to form an alliance with a patient and assume that they're going to do the best they can to tell me what happened to them, and I will do the best I can at helping them deal with it.
Yeah, there's a world of social media, or a part of social media, that believes in general psychologists, the field of psychology is quote unquote not real. That it's all very suggestive, it's not actually helping people. What do you have to say to those individuals who believe that?
Well, I got to say that I have about 7,000 patients who would tell them they're wrong. I've done this for a long time with a lot of people, and I have seen people get better. I had a woman who was sexually abused. She reported at the age of 12, and the family was afraid to do anything about it. And she realized as a teenage girl that people would, men would comment about her body on the street. She said, I don't own my own body. None of this seems all that implausible to me, on its face. And she was depressed. She functioned well, but she was chronically depressed. She had a psychiatrist using meds. And she came to see me, and I had her use hypnosis. And, the proof is in the pudding. If I were just contaminating a false memory, I probably wouldn't help. But I said, I want you to picture yourself as if you were your own mother and look at yourself as a 12-year-old girl who'd just been sexually assaulted. And she starts to cry as she's picturing herself as this little girl. And I said, I want to ask you one question. Was this her fault? And she said, I'm stroking her hair. I'm stroking her hair. And she cried for a while, and she came out of it. And she called me about a week later, and she said, Dr. Spiegel, my psychiatrist wants to know what you did to me because I'm not depressed anymore. And she said, my friends, they don't recognize me. They don't know who I am. So, even if I'm just massaging a fantasy, which I don't think I was doing, the proof is in the pudding. She came to terms with something. And, many people who have been assaulted blame themselves for things they didn't control. Mm-hmm. They'd rather feel guilty than helpless.
Right. It seems like a form of cognitive distortions that we feel on a day-to-day basis. The reason I bring that up is I have patients where it's pretty incredible that you do this under hypnosis. For a very common situation, if someone describes something problematic that happened with them, maybe it's not as severe as in your case, but they got bad grades on a test, mm-hmm. Someone was unfair to them, and I say, well, pretend you're sitting next to you, and you're your friend, and the same thing happened. What would you tell your friend? And I have them vocalize it, but not in a mm-hmm. hypnotic
Sure.
way. And a lot of times they say something that they're not as kind to themselves as they are to this imaginary person sitting by their side. Mm-hmm. And they're kind of wowed. Why am I being so rude? And I just leave them with that question. And a lot of times that has therapeutic value because the way we treat ourselves is oftentimes worse than we treat others, which is surprising because we're always supposed to be about helping ourselves and being selfish as humans. Right. And yet at times pendulum can swing.
Well, that's great.
Yeah.
Welcome to psychiatry. I think what you're doing is terrific because you're giving them an alternative perspective. Mm-hmm. And one of the things that we're seeing in hypnosis, which I think does it in a more intense way, but is not entirely different, is you're asking them to sort of cut loose a little bit from their routine way of viewing themselves and what's going on and try out being different, just being different by acting as if you were somebody else, giving advice to yourself, for example, which mm-hmm. is terrific. And we found using functional neuroimaging that in hypnosis, you have increased functional connectivity between the left dorsolateral prefrontal cortex and the posterior cingulate. That's what we call the default mode network. It's a part of the brain. I call it the my fault mode network. It's the where you think about yourself, you reflect on who you are. And what you were inviting them to do in perhaps a less intense but very reasonable way is to try out being different, see what it would feel like if you weren't you, but you were someone advising you about what you were doing. Mm-hmm. And that capacity to just let go of who you usually think you are has therapeutic potential. And that's what you're discovering when you do that. Mm-hmm. And I'm seeing when I use hypnosis to do it.
Mm-hmm. Have you, what would the advice be for, let's say you're a patient, you went to your primary care doctor, you get the diagnosis of generalized anxiety disorder, and they say you should see a mental health specialist. You have the option of seeing a psychologist for CBT, psychologist for hypnotic therapy, a psychiatrist for medications. What would be your recommendation to your family member?
Well, it depends, I would say, on what they tried and how serious the symptoms were. In general, we tend to think of psychotherapy for people who have milder to more moderate symptoms and a psychiatrist with meds for someone who has more severe symptoms. But sometimes, even with pretty severe symptoms, techniques like hypnosis and CBT can be very helpful. So the other nice thing is if it's not a life-threatening problem, you can try out a series of steps and see what happens. And where someone like you can be very helpful is give them a little outside view and say, well, you've been seeing the psychologist for 3 months. Are you feeling better or not? If you're not, maybe it's time to try the next step.
How does one find a validated or licensed hypnosis provider?
Professional.
Yeah, professional.
There are. You can go to the website of the Society for Clinical and Experimental Hypnosis. I think it's sceh.net, or the American Society of Clinical
throwback.
Hypnosis. Yeah, that is a throwback. That's how up to date we
Yeah.
are. Or the American Society for Clinical Hypnosis, ASCH.US, I think. Or the American Psychological Association. There's a Division 30 is the hypnosis division, and get referrals there. Mm-hmm. Or the other thing is you can go to your primary care doc who may know a local psychologist or physician who also is trained in hypnosis.
Mm-hmm. Got it.
Or Reverie. Download
for yourself,
Reverie.
yeah. For specifically the topic of pain, because you mentioned that.
Yeah.
I'm not an MD, I'm a DO. So I'm an osteopathic physician, and we have this intimate focus on being holistic, on the idea that the body heals itself. It's not us giving you the miracle treatments. It's about your body getting better and optimizing that as much as possible and actually staying out of the way to allow your body to heal.
Right.
And part of what I do when a patient comes in to see me for pain, whether it's elbow pain, back pain, neck pain, carpal tunnel-like symptoms, is talking about their mental health. Mm-hmm. And this has been both celebrated and berated by not just my patients, but also by the viewers at home who have heard me talk about this. Mm-hmm. On one hand, people are very happy that someone is talking about the fact that mental health can impact physical health, which absolutely can. I'm a big fan of Dr. John Sarno's work. Are you familiar with?
Name's familiar, but I don't know.
A lot of work on psychosomatic conditions and how, the mind-body connection is very strong and probably mirrors a lot of the same principles that you talk about when it comes to pain. And people were happy that we're talking about how mental health can impact not just the experience of pain, but your perception of pain or the volume of pain. Then on the other hand, people are very angry that they're saying, you're just gaslighting me to believe that my pain is not real. How do you approach that situation?
Well, it's related to what you're saying, but a little different because, yes, the danger is that people think they're being told it's all in your head. There's nothing wrong with your back or your knee or your ankle or whatever it is. And I approach it differently. I say, look, like that Lancet study shows that these are people, they all had the same amount of real pain. They were anxious. They had a cut down in their femoral artery. They were lying there for 2.5 hours. They had real pain, but there was a difference in how they handled it. So where I approach it differently is the pain is not all in your head. And I'm not telling you you're giving yourself pain if I show you how you can reduce the amount of pain you feel. And so a lot of pain that people have can either be reactive to the frustration of this, oh, damn, this back is bothering me again. I just feel awful. I'm so fed up with it that it's like the noisy kid in the classroom. You're paying more attention to it. But the other side of that is the strain and pain lies mainly in the brain. The brain takes input signals through the lateral spinothalamic tract, through the thalamus, into the somatosensory cortex, through the salience network, the insula, the dorsal anterior cingulate, to decide how much should I worry about this and how much does it hurt. And that's a constant equation that's going on, and you can control it. So I find that when people imagine with chronic pain, with chronic back pain, if they feel better in a warm bath, I have them imagine in hypnosis they're taking a warm bath. And you know what? The pain goes down, not because they're making it up, not because they don't have a back problem, but because they can train their brain to process the pain differently. There was a very interesting study at the University of Montreal by Pierre Rainville and his colleagues. They gave electric shocks to people on their wrist. They hypnotized them, and they said, imagine that your arm is in ice water, cool, tingling, numb, filter the hurt out of the pain. And they got a significant reduction in pain perception. And the reduction was reduced activity in somatosensory cortex. So in the next experiment, same shocks, same subjects, they said, the pain's there, but it won't bother you, which is kind of the way people on opioids sometimes feel. And they also got analgesia, but this time it was reduced activity in the dorsal anterior cingulate, part of the salience network. So they could change the part of the brain that modulated pain simply by changing what the instruction was. So the brain is a very complex sensory processor, and it decides how much attention to pay to all kinds of signals. So the fact that you can use your brain to control the amount of pain you have doesn't mean you're making it up. It doesn't mean that you don't have real pain. It means that your brain is learning to handle that real pain differently. I had a patient, a woman who was 7 months pregnant, really bad lower back disease. The bigger the baby grew, the more pain she had. They couldn't give her opioids because she was pregnant. And I had her imagine she was in a warm bath. Her pain was 7 out of 10 when we started. It was 3 out of 10 after a couple of minutes. And she opened her eyes and she looked angry. And I said, "Your pains, what are you angry about?" She said, "Why in the hell are you the last doctor I got sent to instead of the first?" So if you present it in that way, patients can accept it, they can understand it, and by the way, they feel better. So just using this central processor we have differently can literally change how much pain people are in.
Do you ever struggle with the idea of putting this notion as under more control? Like, so if a patient's in terrible pain and we say, you actually have a tremendous amount of control over this, they feel burdened by that new information. And I'll give you why I'm bringing this up.
Okay.
We know that if you go into a caloric deficit, whether by burning more calories or by consuming less calories, you will lose weight. That's just like a typical scientific formula that we know works. And yet there are now medications that are being created to help us stay away from the foods. And there's a notion that if you say, oh, just burn it off, you're facilitating more of a problem by burdening patients more who failed to lose weight. Is there a similar line with this pain control?
Well,
concept?
the Ozempic and the other drug problems now are, I think, a very problematic way of approaching what is a bigger problem than that, because part of the reason that many people have such a problem with eating and weight is the overprocessing of the foods we all eat.
Right.
And so we lose connection with our body's satiety cues, and we don't eat when we're hungry and stop eating when we're full because we never really feel full because everything is so overprocessed that you don't know. Your body doesn't know when it's full and when it isn't. And so I think that I'm not a big fan of the drug fix for this, and people lose muscle as well as fat when they take these drugs, and it's very hard to rebuild that muscle once you lose it. So I think teaching people, it's cruel to tell people they have mental control over something if they don't, but it's also cruel not to tell them they have mental control when they do. And so what I try to do to help people eat better is to focus on being more in tune with your body's signals. To eat when you're hungry and stop eating when you're full. And if you're hungry again in a half an hour, eat again. But when you're full, stop eating again. So getting more in touch with your body and using your brain the way it was meant to help regulate your hunger and satiety.
How, you mentioned that specific distinction when trying to help, giving someone an idea of control when they don't have control could be a problem. How would you know if a patient has the capacity of that control?
Well, the nice thing with hypnosis is try it. The worst thing that happens is it doesn't work. I do have patients who don't respond, who say, "Thanks, doc, didn't work." Okay, I can live with that.
Are there conditions that you see that happen more for?
I would say, regulating eating in the eating environment that we're in now is sometimes difficult. But I had one guy who used Reverie because he saw a picture of people at a party, and he said, "That's funny. That guy's wearing the same shirt I am." And his son said, "Dad, that's you. That belly is yours." He wasn't facing it, and he started eating with respect for his body. He did self-hypnosis with Reverie every day. He lost 33 pounds. He started walking to work in a neighboring town. He used to be the kind of guy who would drive around the parking lot 3 times to get closer to the door. He stopped using his car, basically, and he's kept off the weight. So, you try it. If it works, it works. If it doesn't, no harm, no foul.
Have you ever had a case that wasn't maybe mental health focused, but more physical, where you saw hypnosis made a big change and it shocked you?
And it shocked me. Oh, there were a lot of times when people are surprised at what they can do, and I'm surprised at what they can do. I had one woman who saw we were running a study on using Reverie for smoking cessation, and she said, I don't even want to stop. I smoked for 25 years. I really like smoking, you know. But she said, oh, it's a study. You'll pay me a little money to be in the study. I'll be in the study. First time she tried it, she hated it. She said, this is stupid. And that night she went home and she listened to the Reverie thing, which was, for my body, smoking's a poison. I need my body to live. I owe my body respect and protection. So she's focusing on what she's for, not what she's against. You don't say you won't want a cigarette. That's not the issue. Would you do this to your baby? Would you do this to your dog? No. So your body depends on you as much as they do. And she looked at the cigarette and she said, "Feh, who needs this?" And she wrote me, she said, "This is some kind of crazy-ass voodoo shit." She said, and I mean that in a good way. She said, and she's helping her friends stop smoking now. They can't believe it. So there is this element of surprise that I bump into with people who use it. They're surprised that it actually worked, that they could help themselves in a way they hadn't thought of before. And I just love that. I think that's so cool.
You're obviously very intimately familiar with the steps of change, pre-contemplation, contemplation. How does hypnosis kind of skip over some of these steps?
Well, that's a very interesting thing you point out. And I know Dr. Prochaska, who came up with that, and his daughter, Jody Prochaska, is at Stanford and is a leading smoking researcher now. And in fact, it's interestingly, she's working with a different One Leaf, another hypnosis app to help people stop smoking. So it does. You're right. It does. You do kind of jump the line with hypnosis. You know, it's something where rather than having to look step by step why you got there, analyze your problem, and take small steps toward making a change, you just say, what if I were different? You know, what if instead of focusing on my urge, I focused on my body and my responsibility for it? And sometimes people can just find themselves, surprise themselves by being different. And that's one of the neatest things about hypnosis, is that it can happen very quickly and very suddenly. And if it does, great.
Have you ever used hypnosis on yourself?
I have, you know. Well, what's that say about he who is his own doctor for a patient, you know, is, himself? I've used it. I took a terrible overnight flight to London and had a banging headache. It was just awful, and I was kind of tired, and I wasn't thinking very well. And I put my only shilling into the aspirin dispenser, and it swallowed the shilling, and I didn't get the aspirin. And I'm bouncing on the bus into London, I think, you idiot, you do this for a living. You know? And so I imagined a pack of ice on my head, cool, tingling, and numb. And I was as surprised as anyone else when the headache was gone. I've used it also to water ski. I was a terrible water skier. I like to ski, but water ski. And I kept face planting in the water. And so I just hypnotized myself before, and I said, arms straight, knees bent, arms straight, because I was doing the opposite, of course. My knees were stiff and my arms were bent, and I was water skiing, you know. And again, I know this stuff, but I was surprised. So I've used it for that and for some pain issues. I had a recurrent dislocating shoulder, and it helped me deal with the pain.
It's so interesting. There's so many aspects of psychology that people buy into. Visualization, for sports psychology,
right.
You know, all of these things that are used in hypnosis quite successfully.
Right.
But because of the title hypnosis, I feel like you lose a lot of buy-in. Is there any movement towards changing the title of hypnosis?
Well, you know, I couldn't get away with it. If I'm doing it, doesn't matter what it is, it's hypnosis.
Right. Well, that's because what you were talking about with water skiing is it's visualization.
Yeah. But you know, Tiger Woods did it for golf. He hypnotized himself before every swing. He did extremely well. So the Chicago Bulls used to have a hypnosis practice every morning, you know, before they went out and did their physical practice. So Michael Jordan, you know, did self-hypnosis.
Why is the human mind so susceptible or programmable, or whichever word you choose there, to the idea of imagining and then having that imagination play out? So, you know, emotional mimicry or positional mimicry, or the idea that you watch a movie and on fMRI, it's like you're doing the same action as those people are, the same areas of your brain light up. Why does the brain do that?
Well, I think it's a way of using our considerable resources. We have a big brain for creatures to anticipate and react well to stress and danger. It's if you can visualize, we have a huge part of our brain, the whole occipital cortex is devoted to visual processing because that's our best sense, actually. If you want to protect yourself, you want to see what's coming at you from various sides. And to then practice or prepare for fighting or fleeing, dealing with what you have to deal with. And I think we use this kind of imagination as a protective device, but also as a developmental device to know what you need to deal with, what you should worry about, and what you shouldn't. I deal with that. I worked with the Stanford women's swimming team. They're terrific swimmers. A lot of them wind up in the Olympics. But the coach noticed that they were doing better times in practice than they were in meets. And you think, what the hell's that about? Your sympathetic nervous system is going. And what we found out when we talked to them was that they were being distracted by worrying about what the girls in the neighboring lanes were doing. And what I had them do is practice swimming their best race, which meant being in total tune with your body. What does your body need to do? How does it need to do it? Swimming is not a contact sport.
Like blinders,
right,
tunnel vision.
Yeah. Tunnel vision, be in touch with your body. There's a wonderful book called Zen and the Art of Archery, in which an anthropologist studied Zen archers. And what he learned was that it's a mistake to focus on the target. The Zen teacher says, if you are in a correct relationship between your body and the bow and arrow, the arrow will go where it needs to go. But if you think about it, what matters is your relationship to the bow and arrow or to your body if you're swimming, not the target. So if you're worried about whether the girl in the next lane is going to beat you, you're distracting yourself from how you manage your body. And that's one of the wonderful things your brain can do, and hypnosis helps you to do, is narrow your focus. Don't worry about what's going on next to you, and intensify your focus on how you make your body do its best. And so I think it's, we are not the greatest physical specimens in the animal kingdom, but we have this brain that helps us make the most out of the body we have. And that means being able to plan, assess, and conduct activities in our body in a way that is optimal.
Well, you mentioned the word Zen. I know there's a part of Buddhism where people live high in the mountains, in snowy temperatures. They can thermoregulate their bodies differently. They can feel pain differently.
Yeah.
Is that a form of hypnosis?
I think to a certain extent it is, yes. I think it's a way of being in tune with, and to the extent you can, able to regulate things that ordinarily we wouldn't. For example, we did a study, this didn't involve Zen, but it involved an hour of self-hypnosis first thing in the morning before anyone had eaten anything, when they took a gustatory tour of the Bay Area. They ate imaginary meals. And one woman, after a half an hour, said, "Let's stop, I'm full." And they had an 89% increase in gastric acid secretion. So their brain was telling their body, food's coming, get ready. We then had them imagine they were on a desert island somewhere, no food or drink, but they were comfortable and happy. 39% decrease in gastric acid secretion. And then we injected them with pentagastrin, which stimulates gastric acid secretion. We still got a 19% reduction in the amount in response to pentagastrin when they were just imagining being comfortable but not eating. So the brain has a whole lot more ability to control the body than we ever give ourselves credit for.
Yeah, and I feel like we're not educated. Forget me as a doctor. Like, the general public isn't educated on the capacity of the brain in that way.
Yes.
Where it works both ways, that there's ways that we can control our bodies in such positive ways, right? Like the idea of tunnel vision during sports or performance. But then there's also some negative ways. Like, I see very often my patients come in with sleep tracker apps that tell me how terrible their sleeps are when they're chasing that perfect sleep. And they may have woken up feeling fine, but the app tells them that they didn't. And now they've implanted the idea that they're sleeping badly and they have worse outcomes. Yeah. Why isn't there like grade 5, grade 3? Here's the power of your brain. Here's the power of what you can get it to do. Why don't we do that as a society?
Well, I think we're trying to do it. And you can have that problem with sleep tracker apps. I know that well. But I really still think the overall problem, Mike, is our underestimation of what the brain does, not overestimation of it. That we don't view it as a tool. We're willing to say you got to work out in the gym 3 times a week, if you want your muscles to work. Do we ever think if you spend 10 minutes a day focusing on how you manage your pain or your stress or getting to sleep, you will build an ability that your brain has to help you live more happily and more comfortably? Now, to some extent with mindfulness, there have been, that has taken over, and Calm and Headspace teach people how to do that. But those are not so much directed at regulating mind and body as they are just openness to experience, not creating struggles you don't need, letting feelings and thoughts flow through you. That's a good thing, and I think it builds a kind of wisdom. But we don't view it as a tool the way a physical workout. I call it a work-in with hypnosis, that you can work in with your brain and figure out very quickly what you can do to make your body and your mind more comfortable. And I wish we spent just, 20% of the time we spend on physically making our bodies better, on mentally making our bodies better, and Reverie is a good example.
Yeah, it's so interesting to see how the transition of the world from your pain is in your mind, rub some dirt in it, full on like this almost toxic mentality, to now you're not in control of what your brain does. You need only this medication can help, and the pendulum has swung so far. Yeah, I've definitely seen that pattern arise in my patients. Have you seen that in yours? Or
although I think culture? More and more now. I started in 1998 the Center for Integrative Medicine at Stanford, and so I tend to see a lot of patients whose first sentence to me is, "I want help with this. I don't want meds." So show me what else to do. And so more and more people, I think, are looking for alternatives to medication to deal with common problems like pain and anxiety and insomnia, which is a good thing.
Yeah.
But I think we still haven't kind of got the idea that there's a lot you can do in a relatively short time to improve the way you're managing your body. It's sort of like management training for your body. We understand that for businesses. We don't understand it for the way we manage our own bodies.
Take me through the idea of what integrative medicine is.
Integrative medicine is basically trying to utilize the kind of interventions, non-pharmacological interventions by and large, that can be helpful for problems like pain. Acupuncture, for example, can be useful for problems like anxiety or insomnia. Habit control, dealing with not just smoking, but alcohol, vaping, other problems that people have. And just do something that will help me better manage this situation that doesn't involve medication.
Mm-hmm. I had a doctor on, a psychologist, just 2 weeks ago. He is a big proponent of the idea of alternative medicine not being real medicine, that it's taking certain foundations or liberties that aren't evidence-based and putting it into modern medicine and kind of mixing it up. Do you feel that at all happening?
Well, I don't like the term alternative medicine because I don't recommend, I'm a physician, I prescribe meds. I don't recommend that people do, get cancer treatment that's an alternative to standard care.
Sure.
So that's why the term, the National Center, which used to be for Alternative and Complementary Medicine, is now NCCIH. The idea is that in addition to what you would do with standard care, you use other techniques that can supplement and help with that. And that's a good idea, and that's what I do. Mm-hmm. And so I'm not in favor of literally alternative medicine. I am in favor of complementary and integrative health.
How does hypnosis end in integrative or complementary medicine when it feels like it's so evidence-based?
Well, because it is not in the sort of the collection of what we consider to be standard legitimate treatments in regular medicine, which is incision, injection, and just...
But CBT and DBT are. Yeah. You wouldn't call those complementary or integrative.
No, that's true. For some reason, because they're often long and arduous, maybe they're more likely to seem like something you have to do for regular medicine. Mm-hmm. but it's also more clearly classified in the psychotherapy domain. And so it does complement medical care because it clearly is not something that's meant to, it's meant to help you better cope with disease-related stressors that you have. Whereas hypnosis is somewhere in the middle where we're saying, you know what, you can really change that pain experience and get yourself off pain meds. You can get yourself off sleeping pills. You can get yourself off anti-anxiety drugs. So in a way, we're in trouble because we are in some ways saying, try this instead of that. Whereas I think CBT is often seen more as a supplement to, although now I just saw a very good article under review saying, look, the first step for insomnia should be CBTI.
Yeah.
And I do that with my patients. I say, you know, your bedroom is a place for pleasure and sleep, nothing else. Mm-hmm. Don't work in your bedroom. Don't look at what time it is when you wake up at 3 in the morning because you just wake yourself up. Mm-hmm. I mean, so I do some of that too.
Right.
So there are places where it is becoming a part of standard medical care. That's a good thing. But that's been a struggle too. Still, most people think if they're having trouble sleeping, give me a pill, you know, mm-hmm. and CBTI is a very good alternative. So, you know, we tend to confound how we define a treatment with the nature of certain types of treatment. And there still, I think, is a prejudice. For CBT, it's widely accepted, but it's still, many people don't think of it as a medical treatment.
Yeah. Yeah, from the general public perspective, for sure.
Right.
Academic, obviously, a different story. The concept of this complementary medicine, like acupuncture, for example, mm-hmm. I tend to take a skeptical stance on a lot of treatments that I don't see very clear-cut evidence-based support for. Like the idea of supplementing all these miracle cure formulas that are on the market.
Yeah.
You walk into any pharmacy, it's like there's a cure for everything, and yet there's a cure for nothing. So I'm very skeptical. I'm very skeptical about acupuncture. But at the same time, I had a shoulder injury, many years, shoulder wasn't working well, constant pain, did acupuncture one session at the behest of a pain management specialist who's an MD. And after one session, my pain never came back. And being someone that's so skeptical, not understanding the pathophysiology of what's happening, what is the mechanism of action here, I'm confused at how that worked. And also confused that even though we have some controlled studies of like sham acupuncture where the needle's not really going in, where the patient might not know, I don't see great evidence-based support for it. But then we do still recommend it at times. Where do you fall on that spectrum?
Well, acupuncture, there have been some studies that show that acupuncture analgesia is blocked and reversed with naloxone. So you give an opioid antagonist, and it doesn't work as well. So we have lots of opioid receptors in our brain and our bodies, and it makes sense that acupuncture may stimulate endogenous opioids. That's what that kind of study would tend to indicate. So it's not all that implausible to me. And it also, you know, to the extent that anxiety and frustration complicate the course of a painful injury, if you can just be doing something that gives you the impression, and there was one very good acupuncture study out of Harvard where they had two kinds of acupuncture for real administered pain. And they had, one kind was, you know, very supportive, warm, I'm sorry you're suffering with this, you know, the long conversation while the acupuncture is going on. And the other one was just, you know, the caricature of an abrupt surgeon, you know, just lie there and be quiet and don't interrupt me and I'll fix you, you know. And they got much more analgesia from the kindly acupuncturist than from that one. Mm-hmm. And so, look, you know, you can't isolate our brains from our bodies. Mm-hmm. And so every treatment we do has a mental component to it, as well as a physical component. And the nature of both will likely have an effect on the outcome. And that's not such a mystery.
Mm-hmm. Yeah, because, you know, in seeing how other acupuncture providers do it, they'll talk about energy levels and like your chi and centering it. And there's like Reiki in some of these places that's being done. I mean, that's where I get lost. Yeah. And I start understanding that it's probably a combination of placebo effect plus that warmth that's lost in everyday medicine.
That's
where
true.
The more touch points you have with the provider who you have a good connection with, the better your outcome is going to be regardless of their training, whether or not they're a therapist, a social worker, a psychologist, psychiatrist. If you bond and they care, you will have better outcomes than if they don't.
You know, that's kind of comfort, and it starts with, you know, how does a mother comfort an injured child? She hugs him and soothes him. And so if your brain gets into a frame of mind where whatever the injury is, I'll feel better about it if I'm getting soothed and comforted. And that will change the actual experience of pain. And so it makes sense that some elements of that primal sense of being comforted and soothed would have an effect even when you're a grown-up and dealing with it. But, you know, it's not like, you know, suddenly you're cut off from the neck up and it's just stuff that's happening to your body. So that makes perfect sense to me, you know, that the combination of the two would have a kind of combining effect. I will add, however, there was one very good study on placebo versus hypnotic analgesia. And so it was a cold pressor task, hand in circulating ice water, so you knew how much pain they were getting by what the temperature was. For low hypnotizable people, the placebo and the hypnotic analgesia were exactly the same. For high hypnotizables, they got much more pain relief from hypnotic analgesia than from placebo analgesia. So hypnosis adds something to the placebo effect.
If they're hypnotizable.
If they're hypnotizable, right.
Right. What's one question about this field that you wish people asked you that no one asks?
That's a great question. I wish they would ask me, what is the underlying assumption that makes hypnotic analgesia, for example, plausible? That it makes sense. That it's not why does it happen, but why wouldn't it happen? That's the kind of question I would like.
That makes sense because you described it so well with the default mode network and how the brain processes pain and sensory information. So
well, and there's one other part that I haven't talked about, and that is one thing we saw very clearly using functional MRI, high and low hypnotizable people in and out of hypnosis, is you turn down activity in the dorsal anterior cingulate. That's the part of the brain that's the keynote of the salience network. So when you hear a siren like we're hearing outside there now, the salience network says, uh-oh, that could be trouble, pay attention to that. In hypnosis, you turn down activity in that region. You just stop worrying about other possibilities. It allows you to immerse yourself in the experience. And so there are plausible neurobiological reasons why techniques like hypnosis should work. They literally help your brain shut it down. Right. And that part of the brain is full of GABA, gamma-aminobutyric acid inhibitory neurotransmitters that are stimulated by benzodiazepines. People who are more hypnotizable have more of those, have higher levels of GABA in the dorsal ACC. And so it makes sense that you can be your own little pharmacy internally and soothe yourself.
Which is why therapy, when we talk about it, is, I have to take a medication to change the chemicals in my brain. Well, no, you can actually change it through function.
Exactly right.
That's why I think hypnosis is interesting in that it's a combination of so many principles: visualization, mindfulness of being in the moment. It's kind of like all wrapped together in one and trying to make it valuable. Just, I feel like the notion of the word is definitely troubling for some. And I see it. Actually, I don't know how I went this far without asking you. How does one become so interested? I'm assuming it's family-based. But how did you fall in love with studying hypnosis?
Yeah, well, yes, doctor, you're right. It's a sort of a genetic illness in my family. Both of my parents were psychiatrists and psychoanalysts here in New York. And my father, during his training analysis, the analyst one day actually said something. He said, "Herb, would you like to learn hypnosis?" And my father said, "What did I say that led to interpretation?" Well, there was a Viennese refugee named Gustav von Aschaffenburg who had to escape the Nazis from Vienna. He was a forensic psychiatrist. He had a smallpox scar in the middle of his forehead, and he noticed that some of these prisoners he'd interview would suddenly just sort of nod off and act differently, and he realized they were being hypnotized, that he hadn't initially intended that. So he taught army docs to use hypnosis. My father used it in combat in North Africa to help with pain control when people were wounded, to deal with combat stress reactions. And he came back here and initially went back to his analytic training, but eventually found that he was doing more good for some of his patients with a few sessions of hypnosis than with 3 times a week on the couch psychoanalysis. So he shifted his practice more and more to hypnosis, and the dinner table conversations were interesting. And I took a hypnosis course in medical school to see if I wanted to do it. And I found it remarkably effective. My first patient was in Children's Hospital in Boston. And the nurse says, Spiegel, your next admission's an asthmatic in room 375. And I followed the sound of the wheezing down the hall. And there's this pretty 15-year-old girl, knuckles white, struggling for breath, third admission in 3 months for status asthmaticus, unresponsive to subcutaneous epinephrine. Mother's standing there crying. I didn't know what to do, but I'd taken the course. So I said, you want to learn a breathing exercise? And she nods. So I get her hypnotized, and then I think, oh my God, we haven't gotten to asthma in the course. What do I tell her? So I came up with something very clever. I said, each breath you take will be a little deeper and a little easier. And within 15 minutes, she's lying back in bed. She isn't wheezing anymore. Her knuckles aren't white. Her mother stopped crying. The nurse ran out of the room. My intern comes looking.
You weren't afraid that she was fatiguing and needed to be intubated?
In retrospect. But she was breathing. She was and I couldn't hear the wheezing anymore. That was okay. You didn't need a stethoscope for that, you know.
Yeah.
And the intern says, I thought he was going to pat me on the back and say, what did you do? He said, the nurse has filed a complaint with the nursing supervisor that you violated Massachusetts law by hypnotizing a minor without parental consent. Now, Massachusetts has a lot of weird laws. That is not one of them. And her mother was standing right next to me. He said, so you're going to have to stop doing it. And I said, why? He said, it's dangerous. I said, well, you were about to give her general anesthesia and put her on steroids, and my talking to her is dangerous? I don't think so. So take me off the case if you want. So he stomps out the room. There was a council of war with the resident, the chief resident, the attending, and they came back with a radical idea for Children's Hospital. They said, why don't we ask the patient? And she said, oh, I like this. So she kept doing it. She had one subsequent hospitalization, but went on to study to be a respiratory therapist.
Wow.
And I thought that anything that can help a patient right in front of our eyes, you know, faster than most medications would work, and violate a non-existent law in Massachusetts had to be worth looking into. So I've been doing it ever since.
So you think that there was some kind of effect regulating smooth muscle contraction and inflammation?
Eventually inflammation. I think that doesn't happen that fast, but certainly autonomic regulation. I think she was, reducing her sympathetic outflow, which could have been, complicating the stricture of her bronchi, and some parasympathetic activation as well to just help soothe her. Because the minute the minute it starts to happen, people with asthma panic. They think, oh my God, I'm not going to be able to breathe. It's a horrible thing. You feel like you're suffocating. And the more anxious they get, the worse it gets.
Right.
Conversely, if you show her a way in which you can make yourself, she starts to feel, hey, I'm feeling a little better. It breaks that vicious cycle, the mind-body interaction. That's a big problem with stress. And what we do in Reverie is teach people, start with your body up, get your body comfortable, and then deal with the thing that's making you anxious. Because the physical hyperarousal only confirms what you worst fear, that something terrible is going on.
Yeah.
So there's no reason why that can't work in reverse, too. You start to feel better. You think, oh, okay. And you can reduce that sympathetic activation that's making the problem worse.
Yeah. I mean, it's so interesting. I wish you would look at some of the osteopathic curriculum, because so much of what we talk about is this subject. In fact, from one of my main talking points when I give patients counseling on low back pain, for example, if I do a full physical exam and I see that there's no serious injury where they have harm to themselves from just walking around, very commonly a patient will get up in a guarded state, expecting the pain. Basically having the volume at full blast, trying to feel the pain as quickly as it can. And they're almost prepping themselves for it.
Right.
Whereas I'm like, stand up, and if you feel the pain, say ouch and move on, but there is no point expecting it. And you're not actually guarding anything, because you're not going to throw out your back by making a slight movement. You're young, you're healthy, there's no serious injury here.
Right.
And that can break the pain cycle in the same way that you're modulating the sympathetic activity.
Well, you see, you're a hypnotist and you don't know it.
It sounds like all doctors are hypnotists and don't know it.
The good ones are.
Yeah, for sure. So that was where you fell in love with.
Yeah, it would be right in front of my eyes, and I that my father did it was something of an obstacle, but I learned a lot from talking to him about it. And I eventually taught in his course at Columbia on hypnosis. But yeah, it was just proving to myself that this thing really works. That
when you misbehaved, did your father try to throw a little hypnosis your way?
I don't think so.
What since you started in the early days, for your young days when doing hypnosis, What is one thing that stands out that changed in your understanding of the field? Or you changed your mind on?
Well, I was impressed by the fact that we could show, for years we were showing that it worked, but I wanted to know how it worked. And I think a turning point in two ways came when about 10 years ago, we published several papers showing what's happening in the brain. That your inverse functional connectivity between the DLPFC and the PCC, reduced activity in the dorsal anterior cingulate, and hyperconnectivity between the prefrontal cortex and the insula, the mind-body pathway in the brain. I said, okay, we have a pretty good idea of how it works. This isn't just magic and smoke and mirrors. We can see what's happening in the brain, and it all makes sense. But the other turning point was, enough. We've got evidence that it works. It's safer and often as effective or more effective than things that have significant side effects that are habituating, where you have withdrawal hyperalgesia from opioids, for example, and it's not being used. And I got to a point where I've just thought, I can't do this forever, and I can't wait forever for people to kind of get it, that this is a scientifically proven effective treatment. So I'm going to do everything I can to make it available to anyone. Download Reverie, Mike 20, you'll get a discount on the app, and give it a try. Because I got tired of waiting. I just thought, be a good Boy Scout, just keep doing the right things and people will come around. And as you said, there is resistance to the name. I can't do anything about that, but what I can do is try and change it and say, okay, you think it's this, but it's really that. Give it a try.
What do you think the next future breakthrough in psychology will be?
Well, I think there are a couple of things. There are some really interesting breakthroughs now. My colleague Nolan Williams at Stanford is using transcranial magnetic stimulation, highly effective treatment for depression, where you stimulate the SAD node in the cingulate, another part of the cingulate, the subgenual cingulate cortex, and it is proving remarkably effective in reversing depression quickly. And even suicidal ideation quickly, like within hours to days rather than, the month that an antidepressant typically takes. We're using it to increase hypnotizability, actually. We have some evidence that it works for that.
I've even seen some of these tools for chronic insomnia.
Yes.
Where there's some FDA-approved ones that just came out not so long ago. I thought that was pretty interesting. Have you seen successes with those? Or?
I have not seen it with that, but I think it makes perfect sense to me. What you're doing is autonomic re-regulation. You want to decrease sympathetic arousal, increase parasympathetic, the rest and digest component of the autonomic nervous system. It would make perfect sense to me that it would. I think the other thing that's really interesting now is psychedelics. There was just a paper in Nature with some of the leading neurofunctional neuroimagers showing that if they take a psychedelic, and they get disorganization of the posterior cingulate cortex. So it's as though you're kind of taking the pieces apart and rewiring. Neurons that fire together wire together. And the fascinating thing about psychedelics like psilocybin for dying cancer patients is it's just 1 or 2 sessions, and they're different after that. So the typical model in psychopharmacology is just occupy the receptor as long as you do, you'll get the effect. And this is different. Saying you just take it a couple of times and get some supportive therapy as well, and your view of your dying has been changed. You are a different person. And I think what we get with hypnosis is a lighter version of that. It's a suspension of who you are, and this is a kind of dissolution of who you think you are. And so I think that's a new direction in psychopharmacology and in psychotherapy of thinking about how we are more flexible as people than we give ourselves credit for. And if you know how to change and are willing to, you can in a hurry.
Yeah. I think that cognitive flexibility has been shown to be very valuable for not just problem solving, but resilience after a traumatic episode. I had Dr. George Bonanno here talk about the resilience trajectory and how interesting that is. Oh, speaking of that, controversial question perhaps, but do you think the body keeps the score?
Yes. Oh, my friend Bessel van der Kolk. You bet. We were residency mates together.
Oh, really?
At Mass Mental Health Center. Yeah.
Wow. Okay.
I've known him for a long time. Yeah, I think it does. I think he's absolutely right.
Where do you think that is?
Well, I think it's likely in the amygdala. It's in the anterior cingulate part of what fires off the salience network is your accumulated recollection of things that pose a threat. And so I think there are these psychophysiological pathways that involve the autonomic nervous system, the glucocorticoid system, the adrenal medulla and cortex regulate our major hormonal regulators of arousal, and it makes sense that they're connected to parts of the brain that trigger and sense arousal. And so it makes perfect sense to me that when you have been flooded with serious threats to your body safety, your brain would learn and remember it and activate as though you were going to be attacked again. And that's part of why exposure therapy works, I think.
Right. I mean, that nervous system hyperexcitability post several ACEs or adverse childhood events absolutely makes sense. The reason I brought it up is because Dr. Bonanno pointed out that while that's true, the excitability of after having all of these traumas, the idea that you would forget said trauma and the body would remember it, to him, didn't add up. Does that make sense?
Yeah, I think he's wrong. The brain is a keeper of information, but one thing that's important for survival is even if you have been traumatized, and God knows our ancestors were, well, our current humans are as well, if you could not regulate your response to severe threat, you would be in more danger for succumbing to subsequent threats. It needs to be accurate. You need to be alarmed when there's a real threat to your health and safety, but not when there isn't. And the fact that it's an overwhelming signal means that the brain probably has to either, lose itself in response to it or perhaps over-suppress your reaction to it. But if you consider the kinds of trauma that people have gone through every day in this planet, in the last few years, their brains have to have ways of not living in that misery all the time or they couldn't function. So if the brain, in order to do that, has to undermodulate at times when you ought to be scared or overmodulate at times when you really need to think about other things, day-to-day things, that makes perfect sense to me.
So it's not like the idea of active repression to me makes sense, right? You're trying to suppress the thoughts because you don't want to feel it. But the idea that your brain automatically does it is also feasible?
Well, yes. And in fact, there have been studies that show that the inability to recall traumatic events starts with a deliberate attempt to suppress thinking about it.
So you start that
way,
and then it becomes passive.
Right, and the brain says, okay, I got the message. All right, enough. It becomes automatic, and that's just efficient use of computational resources.
Yeah. Have you ever gotten in the academic space any criticism of your work?
Oh, never. Nobody. Sure.
What do they say?
Henry Kissinger said the reason academics fight so bitterly is that the stakes are so low. But sure. I published a study in The Lancet in 1989, randomized clinical trial showing that women given weekly supportive expressive group therapy for advancing cancer lived 18 months longer than controls. And there were all kinds of people that couldn't possibly believe that. It was a widely cited article. It still is. But there are some people that just couldn't believe that was possible. And they said it was one or two outliers. Well, it was not. It was a huge effect. And we've just finished another meta-analysis showing that psychosocial support affects survival. And there are people that couldn't stand the idea and thought I had to be wrong. But there was an article in the Journal of Clinical Oncology with like 700,000 patients in the U.S. followed over 5 years showing that being married extends overall survival 4 months on average. And they noted...
If it's a happy marriage.
Overall. You have to take the bad ones too. Interesting, it helped men more than women. Being married was better for men than it was for women, which I consider...
I could see the health advocacy aspect of it.
Right. And they commented in the abstract that that's about the overall average length of survival enhancement from chemotherapy. So it's not minor. So we're psychosocial creatures, and effects to our psychological and social environment has an effect on survival. So I took a lot of heat for that, but that's all right.
Well, whenever there's a trailblazer, there's always naysayers. So
Yeah, I've noticed.
Well, I appreciate your work. Thank you
you.
so much for making the time for chatting with
Thank
us.
you
I
very
think there's
much.
going to be a lot of value to the audience from your words.
I hope so. Well, it's been a fascinating interview. Thank you for
thanks.
doing it.
If you think hypnosis sounds interesting, click here to see my video on 10 natural cures that are actually proven to work. Duct tape? Yeah. As always, stay happy and healthy.